Hi there, Megan Jansen with Employee Wellness Solutions Network. I'm thrilled today to be talking to Jennifer Elia, AVP of Integrated Health Solutions from Sun Life Financial. Jennifer, thanks so much for chatting today. We're going to really jump into elevating the profile of employee and corporate wellness, and thanks so much for chatting today.
I am so thrilled to be here with you, Megan. We've been having this conversation for a long time together and very excited to have this dialogue with you today.
Good, awesome. Let's get right into it. You have a passion, just like I do, around the health promotion prevention side of workplace wellness. And we've been in this industry a long time. And can you share with me, what do you think the most pressing workplace health gaps are?
Yeah, and well, there are a number of things that are top of mind for me in 2018, and as we start to round the corner to 2019 and even 2020, if we think about some of our longer term plans, I really have noticed a shift in employers in terms of their focus on concrete, very specific opportunities that are uncovered by various health data streams for their organization. So what we used to see was employers trying to really boil the ocean, trying to cover a lot of bases with their workplace health and wellness strategies, everything from absence management through to prevention, and oftentimes not so focused on what the actual most pressing needs are. So what we're trying to do now, if I think about the most pressing gaps, is leverage data and insights, even things like predictive models, to identify what those pressures are and even look out onto the horizon as to what might be coming in the months and years ahead, so that we can develop a really targeted approach to getting ahead of some of those trends. Of course, we continue to see Canadian employers and employers all around the globe dealing with mental health issues. So if I were to call out a specific health area of focus that is really quite urgent for employers to pay attention to, it would be that. And then it would be looking at your data and insights to really develop a plan around addressing that gap.
That makes sense. In terms of the leveraging some of the resources available, though, to employers to help with this gap, how would you recommend employers really look at those public and private sectors for help?
Yeah, we talk a lot in this year, I would find more so than ever before, about something we're calling the mental health ecosystem, or broadly even the health ecosystem. And it's really important to look at all of your different providers, look at the public sector in terms of what's available, and what can seem very, very daunting, develop an organized plan around how you can leverage those different resources and those different providers to be able to achieve objectives. So everything from the Mental Health Commission of Canada to your partner resources with companies that you work with, your EAP provider, your insurance carrier, those are all key players when you think about navigating all the different partners to address the gaps that you have.
And really looking at a model that works with the culture. I find in this world of directing programs and helping organizations really see change. There needs to be, I find, a plan and a strategic direction in really whatever employers are wanting to do. You mentioned objectives and really trying to own in on what those are and tracking them along the way. That's important.
Yeah, I agree with you, Megan. And one thing we often say to employers, it's not always about implementing a costly program. It's about picking your sweet spots and maybe even having some grassroots initiatives that start with that cultural piece so that you're building a strong foundation. And again, if you use mental health as an example, sometimes it's just simple manager training, leader training, so that we've got the skills as leaders to support our employees and really create that culture where it is okay to talk about both our physical health and our mental health and the dynamic interplay between those.
So leadership support's critical with any wellness initiative. We talk mental wellness, physical wellness, really anything. So any more thoughts and insights on the importance of that leadership support? I mean, you've seen this probably on both sides, very supportive leaders that really help a program, and unfortunately unsupportive leaders that might hinder a program.
Yeah, and this goes back to the point about the data and the measurement. So one thing I would say we've evolved in as an industry is moving away from huge reports that, 40, 50, 60 pages of data to help to present that business case to a leader as to why this is an impact to their organization, to their employees, why it's an impact to ultimately their results. And we've come a long way. And I would say in 2018, we're in a place now where we are quite adept. And I can think about different organizations that I've seen doing this well at providing that one-page executive summary of here's what's going on. These are your red, yellow, and green zones when it comes to the health of your employees and your organization. Here's what we recommend in terms of improving to get to a better place, and then tracking that progress. So the leadership conversation for those that often are pressed for time, or maybe it's more difficult to gain their buy-in, when it's centered on that picture, that dashboard, that executive level summary, we really can gain that buy-in that we need in order to create the support and the momentum around any sort of initiatives that are going to help us achieve objectives.
So keep it simple. I mean, leaders want to know what's happening for sure. And I love that. That's a great tip, is to keep it simple.
Keep it simple. Yes, exactly right.
Absolutely. Well, Jennifer, any other thoughts and insights when it comes to mental health, leadership training, leadership support, and really the whole discussion piece on the preventative side, and focusing on that?
Yeah, well, actually, I'm glad you asked, because one piece that if I think about all of us who are, as you say, elevating the conversation around workplace health, prevention, being proactive and not reactive, this is not easy work. To be thinking ahead, how do we be proactive and prevent the costly trends of disability and absence, and the impact that can have on Canadian businesses and the Canadian economy. So one piece that I will plant with folks for consideration as we move into the year ahead is really thinking about how to personalize the employee experience. So we talked about over the last number of years, we've gone from a broad strokes approach to wellness to a more targeted and focused approach. And we've been hammering that home for the last few years. Now we're at a pivotal point where thinking about employees themselves, we also need to be very personalized in how we support individuals. And more we can leverage data and insights and digital capabilities to be able to bring people the support that they're looking for. And what's really cool is a lot of what we hypothesized in our space, I know we've talked about this before, Megan, is now showing up in the evidence as the right thing to do. So for example, the Sanofi Canada Healthcare Survey in 2018 and as well in 2017 talks of employees wanting that customized support. They're okay and comfortable with sharing personal health data if the intent is to provide support for their specific health risks when they need it and in the modality that is easiest for them to access.
And it's catering to the individual, which is so important. I love that. And we've talked about it, as you mentioned, that broad stroke approach used to be the way. And now we're getting really much more customized in our plans for organizations to start to see some of those changes. It's all about behavior change. And we find when we're working with individuals and promoting that and sharing and offering and making things available to them, that's really powerful and helping them change their behaviors along the way. So, and it all helps with culture. I mean, you have individuals, supporting one another and influencing one another, and it's bound to have a difference with culture as well. Culture is a big, big deal.
It's all connected, and that's what makes the work that we do not feel as daunting. Is every area that we focus on is connected in one way or another back to culture, back to leadership, back to the data and insights and the goals that we set and the measures we put in place, the conversations we have across stakeholder groups, both within an organization and across partners. As providers, we're working together for common goals and common direction for the health and wellness space in Canada and beyond. So I think it is, I think you're right, it's an exciting time and the perfect time to be elevating the focus on preventative aspects of workplace health.
Great way to tie this up, Jen. Thank you so much again for shedding some light on this very important topic of prevention and health promotion in our workplaces. And I can't thank you enough for sharing what you know. And I've always looked up to what you do and how you do it. And you're certainly a mentor of mine. So thanks so much for all you do. And I really appreciated your time today.
Thank you so much for the opportunity, Megan. I really enjoyed our chat.
Thank you.